this is Dr. Roy Hall. I want to welcome you to this program, Cancer. What can you do better? And I tell you, folks, there's a lot that you can do better in terms of getting through this cancer with less side effects, with better results, and also keeping it at bay much better. And we're just going to go over some of these things over the next few minutes, so welcome. I'm going to ask you, are you at risk for cancer? Does it run in your family? Do you carry the genes of cancer? Do you have cancer right now and going through cancer therapy and want some more help? Do you want to improve your chances of getting your cancer in remission and to experience less side effects from the cancer therapies and more energy? Or have you had cancer and now in remission? How about improving your chances of preventing the cancer from returning? If you answered yes to any of the previous 4 questions, then continue on with this presentation. I think you'll find it very beneficial. Learn what you can do, because there really is a lot you can do. And functional medicine can do a lot for you, for your family, and for your health. So stay tuned and let's go. I trained in medical oncology back in the 1980s at MD Anderson Hospital in Houston and stayed on staff there. After completion of my training in the hematology and leukemia section, and after a short stint there, I said, I need to get back in private practice and take care of patients rather than teaching, and entered private practice in Lubbock, Texas, and eventually, another 10 years later, joined my medical school there for full-time faculty for 2 years in the oncology department, teaching cancer care to the residents and medical students. But again, I was missing the touch I had with my patients and went back into private practice. And overall, I practiced oncology for over 32 years in Texas, Chicago, Kansas, Montana, and now I primarily restricting my practice to functional medicine in Billings, Montana. Now, what is functional medicine? Okay, I'll explain that to you, and it's something that's not new. I started working with functional medicine back in the 90s when I was living in Chicago, and we have one saying. Well, we have a lot of sayings, but one of the sayings we have is the gene is the gun, but it's the environment that is the trigger. In other words, you may be carrying a gene for cancer, but it's not until you do something in the environment and the environment does something to you that that gene is expressed and you get that cancer. And what happens in traditional medicine, the doctors make their diagnoses based upon the symptoms you're having, the story you're telling, and the physical findings they find in you in laboratory studies. In other words, they have all this information being thrown at them, and they make the diagnosis based on what they see coming at them. Functional medicine, we approach things a little bit differently. We go behind the firing lines, and we start finding those things that are causing these symptoms to be shot off, causing these physical findings to appear, and we address the origins of the problem rather than addressing the symptoms of the problem. Diabetes is a very good example, an easy one to understand. Traditional medicine says that if you have diabetes and your sugars are high, then you need to take these medicines to bring down your sugars. Functional medicine, we know that 90% of the people, particularly adults with diabetes, have insulin resistance. And if we can go back and lower that insulin resistance, then either that person doesn't need those diabetes medicines or needs less of the diabetes medicines. The other way of looking at it is if you're taking aspirin for pain and you have to keep taking aspirin and more aspirin and more aspirin because you're standing on a tack and you're having pain in your heel, the functional medicine approach is simply get off that tack, stupid. If you get off the tack, you're not going to need all that aspirin. Aspirin is not the answer, it's movement. So that's what we do in functional medicine, is we go back to the root cause and address that and help create a healing process by doing that program. Now people say, what is cancer? And basically there's 6 facets that define a cancer, or what happens to cancerous tissues. And number 1, the cancerous tissue sustains a proliferative signal. In other words, it keeps growing and dividing, whereas normal tissue like that at the tip of your finger, it grows and then it stops growing. It doesn't keep growing, otherwise our finger would be about 8 feet long. And mine are only about 3.5, 4 inches long. The other thing that happens with cancer cells is they evade growth suppressors. And the body has many suppressors that act on controlling how fast cells divide, controlling how many times they divide, controlling how long they live. And what happens in cancer is this growth suppression is omitted or changed so that this mass keeps growing and growing and growing. The other thing that happens is normal tissue will grow, divide, grow a little bit more, and then stop growing and eventually die. Cancer cells lose this death program. The other thing that's happened is, and it's all somewhat related, is the cancer cells continue to replicate forever and ever and ever. This induced apoptogenesis means that this is a programmed cell death, that cells are designed to live only so long and then they die with a program sequence. Cancer cells lose this apoptogenesis. And finally, cancer cells tend to invade other organs, which is not normal, and they tend to get in the bloodstream and the lymphatics and travel to other parts of the area, which is not normal. In the past, cancer care has been primarily a search and destroy proposition. In other words, we find the cancer cells and destroy everything there and then hope that things turn out for the good. Nowadays, a more reasonable, more modern, and I think more of a effective program is a search and rescue. In that we search where the cancer cells are, we eradicate those cancer cells, but we also rescue that environment. In the past, say with breast cancer, we'd think, well, the cancer cells are only those abnormal cells of the breast themselves lining, say, the milk ducts in the tissue, or the cells lining the air sacs in the lungs. But now we know it's a field defect. It's not just the breast tissue, but it's also the immune cells in that area have gone awry. And so we have to reestablish order in that microenvironment. We'll come back to that in just a second. So in functional medicine, we work on cancer prevention, cancer reduction at 4 different levels. Number 1, we work on prevention. Number 2, we work with diagnosis and eradication of the original tumor. Next, we change that microenvironment. And finally, we want to address the health issues of that cancer survivor to afford him to have a long, healthy life following cancer. And how do we do this? Well, in terms of prevention, this should be a primary focus for almost everybody who comes in the clinic, and certainly it is with functional medicine docs. And some of the areas that we address is we want to address those issues which promote inflammation and an imbalance of the autoimmune system. We want to work on those factors to reverse obesity. We want to remove those toxins either from the environment or from within our own body that are causing havoc on the system. We need to address diabetes, prediabetes, insulin resistance, and return things back to normal, as we know that diabetes is a system or a disorder that promotes cancer. Next, we need to work on our hormone metabolism and imbalance. And lastly, we have to address stress and its effect on the body. Often we cannot remove stress with people, but we can change how we react to stress, and this is done through some simple techniques, and even diet and lifestyle techniques can help with stress reduction. The diagnosis and eradication of the original tumor, this is where traditional medicine is so good. The new drugs in oncology, medical oncology, the new surgical procedures, new ways of doing radiation therapy. We need these mechanisms, and we must keep this going. Functional medicine doctors rarely tell people forego these traditional modalities of treatment because we need these. We have to eradicate that tumor. And by eradicating that tumor, basically what that does for us, it allows you, the patient, time to heal that microenvironment, to recuperate from the side effects, and to develop healthy attitudes, healthy lifestyle so that the cancer does not come back. So utilizing these traditional methods is very important, both for eradicating the tumor and also for buying us time to make the necessary changes in your lifestyle. Everybody knows that the cancer therapy, whether it's chemotherapy, radiation, or surgery, have huge costs, both not only financial but health cost. And through functional medicine, we can alleviate a lot of those health side effects so that the therapies are more tolerable, the therapies are more effective, and that the results are more long-lasting through functional medicine interventions. Now, this is very important on folks undergoing cancer therapy, again, whether it's chemotherapy, radiation, or surgery, is we need to change that microenvironment. As I said a while ago, we've learned the microenvironment is sick in the cancer tissue. It's not just the breast cells, but it's the immune cells in the area. It's not just the lung tissue and the lung, but it's the immune cells in the lung and even the immune system throughout the whole body. We have to correct these things so that the cancer goes away and does not come back. One of the ways we do this is by prevention of hypoxia or low oxygen levels, making sure there's adequate oxygen, because this is necessary for all the cellular functions to occur. We have to support the mitochondria. These are little powerhouse of cellular energy that are inside the cell. These are what make the energy to keep the systems going. There's things we can do through life support or lifestyle changes that can support these mitochondria so that they function more appropriately. And next, we have to just lower inflammation in the area of the cancer itself and overall systemic inflammation in the whole body. And then fourthly, we need to address the health concerns, needs of the cancer survivor. And we do this again by controlling inflammation and autoimmunity. We need to maintain proper hormone balance and metabolism within the cellular structure of the body. We need to provide good nutrition, healthy nutrition. Exercise is of utmost importance, and many people, after undergoing cancer therapy, are weakened. We need to find ways and exercises that these folks can do, and we can do that. And lastly, we have to control stress and the stress response that we have, as this is very important in maintaining health following cancer therapy. And again, in the past, the approach was basically to find the cancer and destroy it. Again, I've mentioned that we realize now it's a field defect, not just the cancer cells themselves, but the local environment, which includes the immune system. We have to approach this area. And we need to reprogram the energy system or the mitochondria and the immune system. We also know that there are certain genes that we have that can suppress cancer and keep it at bay. We need to learn how to promote those suppressor genes. And there's certain genes which promote cancer that we need to learn how to suppress those genes. And a good example is the story of, say, Angelina Jolie, the famous actress who carries the BRCA gene, who underwent a double mastectomy and removal of her ovaries. From a functional medicine standpoint, this makes absolutely no sense, because even though she's carrying that promoting gene, there's things she could have done, lifestyle interventions that would keep that gene suppressed so that she does not need to have that mutilating surgery. Folks, in the last 3 years, the number of double mastectomies prophylactically in this country has risen threefold, but our incidence of breast cancer has not changed any. And that's because these people are treating the end result, and they're not going back and suppressing the bad genes or promoting the good genes. So, what can you do to better your health? It's very simple. Find a doctor who's practicing functional medicine and get into that clinic, whether it's a he or a she. And there's going to be more of us all over this country. If you live in the Montana area or Wyoming area, you're welcome to call our clinic and come see us at 406-969-6310. If you're outside of this area, simply go to www.functionalmedicine.org. You'll find a place on the website there where you can find a practitioner next to you. I'm not advocating that you replace your medical oncologist with this functional medicine doctor or your radiation therapy doctor or surgeon, but I am strongly recommending, very strongly recommending, that you add this functional medicine doctor to your cancer doctors and even to your primary care doctor. This functional medicine person is going to add so much more to your health care. They're going to lower your chances of your cancer coming back. They're going to improve the success rate of the active therapy, and they're simply just going to make you feel better. So, I hope you've learned something here. If you have questions, email me at roy@royhallmd.com or visit our website, which I didn't list here, but it's www.royhallmd.com. Get well. I hope to hear from you. See you later.